Hello there, it's good to see you as always. This is my doctor, and we get excited when we get to talk about different health topics so that will help you make informed health choices. And of course, today's topic is not different. So welcome to the show, and you want to stick around till the end of the show because today we want to address something that all of us should know, whether men, women, we should all know, and that is all about breastfeeding. And according to the World Health Organization, breastfeeding is one of the most effective ways to ensure that health and survival of the child. But it gets to a point where some women either choose to stop breastfeeding their children or other circumstances that actually force them to stop breastfeeding. So first of all, what is like the correct way to breastfeed your child? Because most of the time we think it's like a natural process, but there are some people who still get it wrong. So how do you breastfeed your child? When is the right time to, let's say, wean your child? And all those questions that you have, we will answer them by the end of the show. So you want to stick around until the end of the show. If you have any other question, feel free to use our WhatsApp number down on your screen. Send in any message or any question that you have as far as breastfeeding is concerned. And of course, we'll forward all the questions to our doctor, who'll be able to answer all your questions. But without further ado, and enough of me talking, and our guest is already here, so it's so good to see you and meet you.
Nice to meet
Welcome
you,
to the show.
Thank you.
And before we start the discussion, because I such topics I get excited talking about such topics.
Yeah.
But before we get on with the discussion, why don't you say hi, tell the people who you are and what you do.
Sure thing. Thank you, Winnie. So my name is Dr. Jane Mate. I'm a consultant pediatrician at MP Shah Hospital, and I am actually very passionate about this topic and in terms of breastfeeding and nutrition in children. So I'm happy to be here.
And we're happy to have you. Perfect person to actually discuss this. Now, like I said, you see, when we talk about breastfeeding, a lot of people will say, but yeah, it's a natural thing. The baby knows they need to breastfeed. The mother knows they need to breastfeed the child.
Of course,
problem solved.
and we've been doing it for ages.
Yes. But you find that sometimes that is not the case.
Yes.
And especially for the first-time mothers.
Yes.
Where they would not know maybe the position of the child or where the child needs to latch on. Like it's a lot.
Yes.
So just help us understand, first of all, breastfeeding. Like, what is it all about and why is it so important? Because we hear a lot of nutritionists, pediatrician all the time talking about, listen, you need to breastfeed your baby.
Yeah, I get it. And you're right. Most mothers and women are led to believe that breastfeeding comes naturally. I mean, women have been doing it since time immemorial.
Yeah.
You know, you have a baby, you need to know how to breastfeed.
Yeah.
Just to highlight the importance of breastfeeding, it goes beyond nutrition for the baby. There are a lot of benefits for mom, there are a lot of benefits for the baby. Simple things is bonding with your child. This is a newborn, the primary caregiver is the mother. So number one, this is bonding for both mother and child. There's nothing more beautiful than seeing a mom holding her baby and breastfeeding her baby. It's actually something very beautiful to see. Second is you have nutrition for this child. It's a perfectly formulated kind of meal for the child. It has all the nutrients you need. It provides immunity. Mom is able to transfer antibodies to her baby directly. So I usually say it's like giving the first immunization to your baby naturally, because you're giving them antibodies against all these kind of viruses and infections. It's readily available. It comes naturally. You don't have to buy it. You don't have to heat it. You don't have to prepare it.
Inexpensive.
Exactly. It's there. It's ready for baby to take. So that's also something to put in mind. It has protective benefits for the baby. Breastfed babies have actually been shown in the first year of life to have less infections in terms of ear infections, respiratory or chest infections. GI infections like diarrhea are much less in children who are breastfed in the first year of life. Long term, it protects them against some allergic conditions such as asthma, atopic dermatitis or eczema, chronic illnesses like diabetes and hypertension. You find that these children are much less at risk of getting this kind of infections. And when it comes to the mom, they say that breastfeeding moms are able to get back to their pre-pregnancy size.
They say that.
I don't know. Moms out there, tell us, is this true? It's true for some. It may not be true for some. But breastfeeding is a calorie burning kind of experience, so there is a lot of truth to that.
Almost try to imagine how that happens, but I mean, like you said,
it takes a lot. You burn a lot of energy and a lot of calories just by breastfeeding the baby. Any mom who's breastfed will be able to tell you that experience. Yeah.
Clearly I'm not, so don't know that.
That's one of the major benefits for mom.
For the mom, yeah.
And then also it's protective for mom as well. Breastfeeding moms have been shown to have less risk of ovarian cancer, breast cancer, and even osteoporosis and like broken bones much later in life.
Oh wow!
So generally, you can see all the beautiful benefits of
just
breastfeeding.
The baby feeding and exactly. I like that.
Yeah.
And then you also talked about an aspect of it's readily available, and I'm pretty sure there's so many women out here who will be like, I wish that was the case for me.
Yes, like I said, there is a challenge where we are led to believe that breastfeeding comes naturally. You know, put the baby on the breast and let the baby breastfeed. What we need to highlight is that it can be challenging. And for most moms, it is challenging, especially for a new mom. It's not anything you've ever experienced before. So for these women, we are trying to demystify breastfeeding and saying as much as it comes naturally, it takes time to get there. And it's something that you have to learn. It's something that the baby has to learn
as well.
Yeah, so I think over the course of the episode, we're going to talk about latching the baby, what it means to have a good latch, and ensure your baby is in a good position. Remember now, delivery comes in terms of normal delivery, the cesarean section delivery. So this is a mom who's gone through major surgery. It's not going to come as naturally for her to start breastfeeding. So we're going to talk about the different ways that we encourage these moms to get to the point where they're comfortable with breastfeeding and now it comes naturally to them.
Now, can we just go back a little bit in terms of when? Because, again, a lot of people think, I mean, see women, right? So they have breasts. So a lot of question is like, so do you already have milk?
Baby comes and the milk
is there. And the milk is there?
Yes.
Or what exactly happens? Like, what's that process like? And especially after, let's say, a lady or a woman gets pregnant, right? When does the milk formation start? Because again, this in relation to what I said or what you said earlier on, where you said, listen, it can be a challenge. You know, sometimes some moms do not have adequate milk for their children, or they're not able to produce milk, you know, completely for their children. So I'm just curious, what is like that process, and when does the milk formation begin?
And without going too much scientifically into it, usually by the third trimester, that's from around 32 weeks going onwards, a lot of women will have milk production in their breasts, in the glands. So you have milk production for majority of them from the third trimester all the way till the time of delivery. There are some women who by the time they are delivering, you actually have milk leaking from the breasts. There are some who do not. And just because you do not have leaking breast by the time you're delivering, it does not mean that you don't have milk to provide for your baby. So what happens is when the baby is born, we really want the baby to latch, and that is to get a hold onto the nipple and start the suckling process. So that suckling process, it's a very emotional kind of process involved, as well as the biological, where the milk is being produced. But the baby's suckling reflex is what stimulates the mom's brain to release the milk, and that is called a letdown. And when it comes to the different modes of delivery, whether it's a normal delivery, cesarean section delivery, or mom's experience of the delivery, it might affect your milk letdown. For example, if you've had a cesarean section, this is major surgery. It's stress on your body. It can be quite painful for the moms as well. So you find, because they're not in a very stable emotional state, or they've gone through this kind of stressful experience, it may take a bit of time for the milk letdown to happen. However, we really encourage moms to at least latch the baby within the first hour, because like I said, as soon as the baby latches on the breast, then it sends a signal to mom's brain, like, hey, this guy is here, he's hungry, we need to feed. So the brain releases a hormone, it's called oxytocin. So that is what helps now the breast release the milk now to the baby. And it continues as cycle throughout the whole breastfeeding process. I'm sure you've spoken to moms and they've said, I was thinking about my baby and my breast started to leak. So it's a very kind of hormonal process. And this kind of hormonal cycle can be blocked by stress, by pain, by fatigue. And that was saying it doesn't come naturally. If you're having a mom who is very stressed and she's tired, she doesn't have emotional support, she doesn't have any physical support, then you find that she's going to have a challenge breastfeeding because there's an interruption of that cycle.
Yeah.
Yes.
All starts from the brain.
Of course. Always starts from the brain. Yes.
Okay then. And we also hear a lot of cases of women who blame themselves. They say it is my fault that my baby is not either latching well or they're not getting sufficient milk.
Exactly.
So what you're saying is try and relax. Just think about you and the baby at that moment.
Yes, exactly. And also the thing we encourage is ask for help. Nobody goes into motherhood knowing what to do. Especially for new moms, it's a new process. The whole latching and positioning, there are challenges, and I'm sure we'll discuss them when it comes to breastfeeding, from cracked nipples to engorged breasts. It's very stressful for a mom to go through that. And it's natural to feel like you're letting your baby down. I'm not providing enough milk. And you see all that weighs in on your head. And now inadvertently it's going to affect your milk let down because you're stressed and all that. So we encourage, especially new moms, always ask for help. From the moment you deliver, ask for help in the hospital. Ask whoever your friends, your family are, ask them to help you take care of the baby so that you can sleep and get as much rest as possible. So don't feel like you have to do this on your own, because then the more help you have and the more friendlier and experience you're having, the better it is for your baby and for your breastfeeding experience.
Do you think we feel that innately as women, that we're superpower? You know, I can be breastfeeding my child but still talk on the phone and still make plans for this and that and all those things.
And I think we've been made to believe that women, you're supposed to do it. Like, come on, this is breastfeeding. You're just supposed to know how to do it.
You know, and all those things. Okay, then. So let's talk about then the process. What are we, and especially for the first time moms, what are you supposed to do to make sure that your baby is well fed?
Yes. So like I said, there are two major things that we try and ensure with new moms, just so that they can have a successful experience. One is called the latch, and how well the baby latches on the breast. So I next time maybe I'll have some demonstrations, so it's a bit easier for the viewer. But basically, if you imagine the morphology of a nipple, how it looks like, you have the black area that surrounds the nipple. It's called the areola. And this is, under that is where you want the baby to be able to latch on the black area, the areola, as opposed to the nipple. So when you want baby to have a good latch, you want baby to open their mouth very wide. Imagine a baby who's yawning, how much they open their mouth. So you want the baby's mouth to be very wide when they are latching, so that they're able to latch on the areola. That's the dark area, as opposed to a very narrow, and then they'll be latching just on the nipple. So what happens when they just latch on the nipple, it becomes very painful for mom, and she's predisposed to getting a cracked nipple, which is a very painful experience. And like I said, pain is one of those things that will interrupt the feedback of oxytocin and helping the milk come down. So you always want to ensure a good latch, and that's one of the things we really try and ensure that we teach mothers, how to get a good latch. So if you have someone to assist you, usually we ask them, you can ask someone to help lower the baby's jaw, so that if they're trying to latch, then if you lower the jaw, the baby opens the mouth a bit wider. So they can lower the jaw as you're trying to put the nipple and the areola into the baby's mouth. The second thing to consider is positioning. Like I said, there are different types of positions depending on what kind of delivery you've had, depending on other factors of how much milk mom has. Like I said, there are some women who have a large milk letdown. So, and I'm sure you've had people saying they'll breastfeed and they feel like the baby's choking because there's a lot of milk that's coming out. So there are different positions. There are moms who have twin deliveries, there are moms who have triplets, and they have to breastfeed these babies. So there are certain positions that are going to accommodate the different kind of modes of deliveries and mom situation. So there's a cradle hold, which is the most common one. And cradle basically means you just cradle the baby very close to you. So you have the head supported on the elbow and the hand supporting baby's bum and the legs.
Yeah.
And then baby is facing you directly. So in this position, you want the baby's nose to be directly opposite the nipple.
Okay.
And you want the baby's tummy to be touching your tummy.
All right.
So baby is completely on you.
On your tummy.
If possible, we actually encourage that it's skin to skin. So minimal clothing, because mom's body is able to keep the baby's temperature regulated and at a perfect temperature. So you want to do the cradle hold, and that's the most common for most moms. A lot of babies tend to be pretty average size, about 2.5 to 3.5 kilos. So they're very easy to carry without it being too tired for too tiring for mom. If you have a bigger baby, the alternative is to support the hand using a breastfeeding pillow, and this is where a breastfeeding pillow comes in. And even without a breastfeeding pillow, you can support with a blanket, a rolled up blanket, or just a regular pillow, just to offer that support. Because remember, you don't want to have a rushed kind of feeding, and you're like, oh, I'm tired. I just put the baby down.
Eat. I need to sleep.
So you want to ensure mom is comfortable. So as much as possible, try and find a way to make mom comfortable. The sitting position of the mom is very important
as well.
Back support. A chair like what I'm sitting on is quite comfortable, because see, my back is completely straight. I have support for my back. I'm not hunching over to try and reach the baby and struggling with my back and wondering, oh my god, every time I breastfeed my back. So always make sure mom is comfortable. She has some good back support, and she always brings baby to her chest. We don't encourage them to hunch over, because like I said, you can imagine if every time you're eating, you're like this. By the end of the day, you're not even interested in that meal. So mom has to be comfortable. And then now we teach them about the different positioning for the baby. And for moms who have had a cesarean section, the different options where mom can breastfeed when she's lying down, and baby can lie down right next to her, so that it alleviates pressure on the scar. Because again, we said you want to cause as little discomfort and you want to alleviate pain for a breastfeeding mom as much as possible, so that she can enjoy the process.
Now, what happens to the hands? Because I see a lot of women, I don't know, do you do this?
Scissoring and holding the nipple.
What's that all about?
So again, that's something that we try and teach moms. There's a misconception that you have to hold the breast for the baby, and if you don't, the breast is going to suffocate and cover their nose.
And the baby will, or the milk will come out like a lot, and then
the milk will come out a lot. Exactly. So this kind of position is called scissoring. And we actually discourage it. Because if you imagine you're trying to squeeze the breast, you're actually obstructing the flow of milk. Because remember, there are ducts in the breast tissue which are carrying the milk to the nipple area and now opening up into the baby's mouth. If you're pressing with your fingers, then it can cause some obstruction or some blockage of the milk flow. So what we actually encourage is, if you need to support the breast, or if there are women who have bigger breasts and you feel like it could actually be an obstruction to the baby, is holding the breast further back and just pulling it back a little bit without necessarily doing the scissoring. Alternatively is holding the breast from the underside and just supporting the breast from below without necessarily holding the scissor hold. And once the baby has latched onto the nipple, there's really no reason for you to continue holding it for the baby, because you'll be able to, if you hold it like this, or if you just pull the breast back, you'll be able to see the baby breastfeeding quite well. And one of the ways to observe that the baby is breastfeeding well is that you'll notice they're suckling and then they'll pause to swallow. So I usually use an example for my patients is, imagine if you're drinking a soda with a straw and you have to pull on the soda, and then you have to pause for you to swallow.
And then swallow.
So this is something that we teach moms to observe, and you will be able to tell if your baby is breathing well, because there is no way the baby will be able to suckle and swallow if they are not breathing. So those are some of the methods we teach, especially you moms. Or take a look how the position is and how you would be able to support the breast if necessary.
All right. Don't have, like I said, you don't have to do.
You don't have to do it.
All right. So learn something. Stop. Don't scissor.
It's no scissoring, not necessary.
It's not necessary. Okay. And then also, there's some, again, moms who will tell you, but if I don't do that, or if I do not regulate the amount of milk that the baby suckles, then they'll choke.
They'll choke.
Right?
Yes.
Or others will say, they have like a very big appetite. or they're fast feeders, you know, they want to suckle and suckle and suckle and all those things. So we try and regulate that.
Yes.
Are we doing that right, or just let the baby breastfeed?
Let the baby breastfeed. Like I said, this is a learning process for both mom
everyone.
and for the baby. And remember, like I said, it's called a suckling reflex. It comes naturally to the baby. They know how to suckle and they know when to swallow.
Okay.
So even for the babies that we say they might be choking, yes, there is some truth that there are a lot of women who will have a very fast letdown. And like I mentioned, for these moms, maybe they might want to breastfeed either in a lying down position. And then the other thing, that if you feel your breast is either engorged or very full, you can actually either pump with the hand or express with the hand, or use a manual or electric pump just to pump a little bit and make it a bit easier for the baby to latch. Because sometimes the breast is so full and it's very firm, and it can be a bit difficult for the baby to latch. So in that situation, you can express, you can hand express if you don't have a pump. Just for to let out a bit of the pressure, and you can also use a pump or an electric pump. And then once the baby has latched, you'll actually see a rhythm to how the baby is suckling, and they are able to regulate how frequently they suckle and they will swallow. So usually you'll find they'll suckle like 2 suckles and then swallow, 2 suckles and then swallow. And even as they're doing that, the mom will feel a change in terms of how heavy the breast is. You feel the breast getting lighter, meaning the baby is able to empty the breast adequately.
All right, that's interesting. Because when you're talking about that, I remember I've seen this like with my mom. You know, she would come and the breast is full, and they would try and squeeze out a bit of it.
Hand
before the baby.
Yes,
before we know.
Age-old trick.
You know. So I'm like, oh, okay, all right, okay. So let's take a short break. But of course, when we come back, we'll still have a lot to talk about as far as breastfeeding is concerned. And one of the things that I think one of the pediatricians I've had talk about is you do not only want the baby to just breastfeed because they're breastfeeding, but you also need to make sure that they get all the nutrients. And they're talking about an aspect of there's like a form. Is it like a foremilk?
Front milk and the back milk.
Yes. Like, when isn't it like mixed? You see the way we mixed formula? Isn't it the way that it's mixed? Anyway, it's a lot. So if you have any other question, feel free to send them to our WhatsApp number down on your screen. And of course, we'll forward them to Dr. Jane, who will be able to answer all your questions as far as breastfeeding is concerned. But for now, let's take a short break. See you soon. All right, welcome back. Glad you're still with us. The show is My Doctor, and today it's all about breastfeeding. So I'm pretty sure all the first-time moms are really, really happy today. Or let's just say women and men in general, because again, like Dr. Jane talked about, an aspect of support. It's very, very important, you know, to have that kind of support, and that will only be made possible if all of us have the information. So if you have any other question, feel free to send them on our WhatsApp number. Okay, we have our WhatsApp number down on your screen. Feel free to use it and ask any question that you have as far as breastfeeding is concerned. And of course, we'll forward them to Dr. Jane, who will answer all your questions. But for now, that aspect of formilk, hind milk, like what is
and these compartments of milk that are in the breast, where are these compartments?
and what determines what comes first? Is it like the formilk? Is it like the hind? It's complication. So help us understand that.
So let me demystify formilk and hind milk.
Okay.
So why we say breast is best is because breast milk is uniquely made for your baby.
Okay.
Your neighbor's baby is uniquely made. The breast milk is uniquely made for her.
Them,
unlike formula, which is very standardized formula, breast milk is not. It changes in composition. It changes from feed to feed. It changes from day to day. It changes from month to month. It changes if mother is unwell. It changes.
How?
That is the beauty of breast milk.
What?
So
okay. Like what? Like so, feed to feed?
Yes, it changes from feed to feed, and hence why breast milk, we talk about formilk and talk about hind milk.
Okay. All right.
You have different components of breast milk.
Yeah.
And it's not compartments like you're thinking about.
Yeah, like there's like some sections before nyuma.
Yeah, like we finished a milk sasa tuanze hiyo ya nyuma. No.
Okay.
So what happens is it's the initial composition of milk. Even when mothers initially when they give birth, the first kind of milk that you get is called colostrum.
Yes.
Very high in protein, very high in antibodies, very rich yellow kind of milk. And even though you talk to moms, they'll tell you, ilo maziwa ya yellow, imeanza.
Yes. And then sorry to cut you short, but I've seen a lot of people squeeze that out, and they say that's not good for the baby.
Oh, wow, that is liquid gold. Colostrum is very high in protein and very nutritious and protective for the baby. So, and again, that is why we encourage that you breastfeed as soon as possible, because the first milk that you get is colostrum. And then over time, you start to get what you call mature milk, which is a bit more liquid and a bit more whitish in color, which is the more common milk that we have seen. So when it comes to foremilk and hind milk, at the beginning of a feed, usually whatever milk is coming out initially is very high in water or liquid content and very low in fat. So it provides for, it takes care of the child's thirst, let's call it that way.
Yeah, because we don't give them
yeah, exactly. And the question will come, should I give my breastfeeding baby water?
Yes.
And here is me answering it.
No.
So you have a very high water content in the foremilk.
Okay.
So when the baby starts feeding, they'll start initially with the foremilk. And as the baby continues to feed, now the composition of the milk will change. It will become a lot more fattier, it's higher in protein, and this is what we call the hind milk. So understand, it's not a compartment. Yeah. It's just about that transition of the composition of milk.
I have a question. So you said it changes feed after feed, right?
Yes.
So this is me thinking. So let's say fine. So you said the first few minutes, it's all about
high water content.
High water content, right? Yeah. And then
later now you have more fat and protein.
Yes. So when the baby stops feeding, okay, so in the next feed, do they start with now more protein and fatty content, and then okay, I don't know. I'm just
so what happens
because like there's some that has remained.
We encourage the mom to empty the breasts, and this is why this becomes important.
Okay.
Because there are moms who will breastfeed the baby for 5 minutes. Yes. And they're like, okay, let me change the breast, and you change to the other breast. Yeah. So the initial feed usually will come out as the more water content. Yeah. And so you find your baby seemingly is breastfeeding very well. You put them on the breast, they suckle, they sleep. Yeah. But you might notice either the baby doesn't sleep for very long, they'll sleep for half an hour and they're awake. Yeah. Or the baby is not gaining very good weight or expected weight when you go to the clinic visits. Yeah. But you're insisting and you're telling Dr. my baby breastfeeds. I put them on the breast, I even change and put them on the other breast. Then you ask, how long does your baby breastfeed? Oh, they breastfeed 5 minutes and I change to the other breast. Yeah. So that's where the challenge comes in. Because remember we said the hind milk, the more the baby breastfeeds on one breast, the composition changes. They start to get the fat, they start to get the protein, which is what will help with weight gain and which is what will help with fullness. So imagine it's like you've come for a meal and I give you a whole bottle of water. Of course you're going to feel a certain sense of fullness because I've taken care of your thirst. True. And in fact, you'll be like, okay, let me sleep a little bit and then we'll see where this goes. You probably sleep for maybe 10, 15 minutes because essentially you've not been fed. Yeah. You just took care of the thirst. But you want the baby to completely empty the breast so that they're having the protein intake, they're having their fat intake, and this keeps them fuller for longer. Yeah. And this also helps with the sleep duration. So you're having a baby who's able to sleep at least an hour or two between the feeds. And this is also reflected in the baby's poop. Yeah. Because the babies who will predominantly get the foremilk tend to have a very light kind of frothy green poop. And this is something else that we ask moms to look out for. What is the color of the poop? And you'll ask most moms, the doctor will always ask you, what is the color of your baby's poop?
Like, why is it important? As long
why
as
is it important? Exactly. Yes. Whereas if you're having a baby who's doing a complete feed, meaning they're emptying the breast, you have a bit more of a yellowish kind of runny yolk kind of color of the poop. So it tends to be yellow pigmented and with some white specks in it. So meaning your baby is getting a much fuller feed.
Oh wow. Okay.
So if mom comes to the clinic and we're saying, okay, your baby is breastfeeding, but is not gaining weight very well, then we ask moms, take your time, put the baby on one breast, and let them actively breastfeed for about 15 to 20 minutes.
Okay.
Or until you feel your breast is getting lighter.
Okay. So is this dependent on whether you have a lot of milk or not? Because there's some women who will tell you, listen, I have a lot of milk. So what if this baby just feeds on one breast for, like you said, 15, 20 minutes? Then what happens to this other one?
So if the baby feeds on one breast, and initially in the first 2 weeks, you'll find baby will not be emptying both breasts. Because again, baby's stomach initially is very little. And as the baby is growing, the stomach capacity gets larger. So we tell moms, if baby has breastfed on one breast, 15-20 minutes, it's empty and you feel baby is full, they have burped and they have even fallen asleep, express the other breast. And even with most moms, you'll find if you're breastfeeding on one, then the other one might actually be leaking. Because remember what we said, there's a milk letdown complex. So the brain is saying, oh, this baby is feeding, we are producing milk. So the other breast will actually be leaking. So what we encourage moms is to actually express. And you can actually express even as baby is breastfeeding. If you have a pump, you can put a pump on the other breast and just actually express what is there. And there will come a time where you might need to top up the baby. Like I'm saying, if there are days where you're tired, or if there are days where mom has to be away from the baby, then this is a perfect substitute to actually give the baby.
Okay. Hey, learning a lot today. Like, oh, okay, all right. Okay then. So, and like we said, it doesn't matter whether you say you have like a lot of milk or anything like that. Just make sure the baby empties one breast.
So it's not a hard and fast rule where I'll say you need to be the baby on the breast for 1 hour.
No,
it's not a hard and fast rule. It's just make sure that the baby is emptying the breast, and at least they're doing 15 to 20 minutes at least. If they're actively breastfeeding for 30 minutes, very good. Let the baby continue. If they're actively breastfeeding for 45 minutes, that's okay.
Now I understand why you were saying it's more of like of a bonding, because when you're bonding with someone, you're not like 5 minutes in, okay, it's so good to
like,
see you, goodbye, see you next time. No, you need time to allow the baby to breastfeed very well, but also empty, and make sure that they get all the nutrients that they need, you know, for them to grow. So I like that. That's important. Okay, but then again, so remember, like I said, the different positioning and different factors that might again lead to, let's say, a mom finding comfort in how you know, they breastfeed the baby. The ones who might be forced to be like lying down, again, is the process the same? You know, as far as then making sure that they empty out, you know, one of the breasts, and then the other one may be expressed, or what usually happens, because again, the position might be
a bit different. So even with the lying down position and with the breast being full, it doesn't change depending on the position of the mom. If the breast is full, you are going to feel the breast being full, and it feels quite firm. So even when mom is lying down, you want to look at how actively the baby is breastfeeding. And I keep insisting on actively breastfeeding, because also remember, it's a bonding process. So you're cradling the baby is next to you, they're nice and warm,
you talk to them,
then they fall asleep on the breast.
I was about to ask that, because they will be like, oh yeah, the baby slept.
So they'll be like, oh, the baby has been breastfeeding for 1 hour. Kumbe, the baby slept a while back. They will still be latching on the breast. And that is why I was saying moms need to know, and we do teach them how to assess that your baby is actively feeding. So again, I'm going to go to the soda analogy. When you're trying to drink your soda with a straw, even your cheeks will move. They'll do So even for a baby, when they're actively breastfeeding, you'll see their cheeks moving, and you'll hear them swallowing. If you're not hearing any of that, just know the baby is using you as a pacifier. They're soothing themselves, they're comfortable, they're happy to be held by mommy. They're not actively breastfeeding. So even in a lying down position, frequently for a newborn, you might need to keep stimulating them every 5 to 10 minutes to make sure that they wake up and feed. Because with everyone, when it comes to hunger and fullness, as soon as they start to feel that they've breastfed a bit and there's some milk in the tummy, they get comfortable and they start to fall asleep. It doesn't mean that they've necessarily had a full feed. And that's a big misconception with moms, especially in the newborn period. Baby will start to breastfeed, 5 minutes later the baby has fallen asleep, and you'll be like, I'm a shipper.
Them off the
they're like, the baby is full, let's sleep. But this is a newborn, and they tend to have a lot of sleepy hours even during the daytime. So we tell moms, actively stimulate the baby. You can either scratch their feet, you can rub their head, and you'll actually realize, oh, the baby will be a bit more awake, and they will continue suckling.
Or even for others that I've seen, you try to take them off the breast, and then Rodoshtuko will be like, oh, come on, still feeding.
Yes, exactly.
Okay.
So in whichever position you put them in, the main thing is to make sure you actively stimulate the baby so that you feel that they've gotten an adequate feed. And some of the ways I mentioned is emptying of the breast, the baby's poop, and the duration of sleep between feeds. If you have a child who's only sleeping for 15 minutes and is awake and cranky, then they are unlikely getting enough milk.
Okay. Now, I mean, you talked about an aspect of formula is more like standardized as compared to breast milk, which is like specially crafted. That is so cool to think about.
Yes, it is unique for your baby.
It is so interesting to think about that. But there's a woman who will say, fine, I really want to breastfeed my baby, but then again, I do not have like maybe too much time or enough milk, for the baby. So they'll supplement with formula. I don't know. What do you feel about this? Because this one, I mean, the breast milk has like all the nutrients and everything that the baby needs, but then there's a formula that is like a bit standardized. So it's like, or this is me overthinking.
No, not really. You have a valid point. And like we always say, breast is best, but there is a role for formula.
Okay.
Remember, there are also moms who may not be able to breastfeed their babies.
Completely.
For whatever reason, mom may be sick, she may be having some chronic illness or infectious illness that is not allowing her to breastfeed the baby. Or the baby might actually also have some underlying circumstances that do not allow for proper breastfeeding. So I firmly believe there is a role for for formula feeding. But for moms who can breastfeed, what we encourage them to do is always start with breastfeeding as your first option. Also because, like I said, because of the way the brain works, the brain responds to the baby in a way that the brain will not respond to a pump or anything else in terms of stimulating the milk let down. So for moms who, if you know you're maybe going to go back to work or you feel like your milk let down is not very good, there are some ways we can help to stimulate milk let down. And one of them is to frequently empty the breast. Milk comes on a supply and demand kind of situation. The more demand you have for the milk, the more supply the brain will give. So even if baby has breastfed on one breast, the reason why we're telling you to empty the other one is because if you leave your breasts full, the brain will be like, no, but there's milk, we don't need to provide any more. So we encourage mom, after you've breastfed and the baby has fallen asleep, pump. Both breasts if necessary. Initially you might get about 5 to 10 ml, but over time, now your brain is going to say, okay, there's still a demand. Somebody's still asking for this milk, so it's going to continue supplying. And after the newborn period, usually between 2 to 4 weeks, once you've established a good milk letdown and you've established a good rhythm of breastfeeding with the babies, we actually encourage moms who know either they're going to be away from their children, whether it's because of work, travel, for whatever reason, we actually encourage them to pump and store breast milk. And you can store breast milk up to 6 months in the fridge. You can store it up to 12 months in the freezer, if you freeze it. So you have all these other options that you can still use your breast milk before you have to opt for formula.
Okay, I can understand, like there might be, you know how people in general, adults, right, who will tell you, hi, chakula imeweka kwa fridge for how long? A week? No, I'm not going to eat that, right? So I'm trying to imagine a mom who's maybe has like enough milk, the baby is full, they still have a lot, that they pump and then store in a fridge. I can understand why some women will be a little bit cautious in terms of feeding their baby milk that has been stored, let's say in a fridge for whatever amount of time.
Yes.
A day or two, maybe yes.
Yes.
But maybe like a week.
In the freezer.
You know, in the freezer for 12 months.
Yes.
You know, so just to help them or just give them peace.
Yes.
Because I can imagine a mom who's like, hey, feed my baby milk in my freezer for like 3 months. No,
Yes.
I cannot do that. Just to give them peace
Yes.
and assure them that, listen, it's okay.
Yes. So for as long as the expressed breast milk is done under clean conditions, so meaning the bottles you're using, the pump that you're using, have to be cleaned and sterilized to prevent infection. Of course, now because you're going to introduce other gadgets like the pump and bottles, there's a risk of infection, these babies. So hygiene and cleanliness is one of the biggest things. And in the rise of pumping and storing milk, there is milk storage bottles, there are milk storage containers which are readily available, and you're able to label them. And when it comes to freezing, it's a pretty safe mode of retaining the nutrients and all the goodness of the baby's milk. And even though you're using the frozen milk, the thing to understand is when you're preparing for a baby to take the milk that you have been freezing, we don't put it in a sufuria and heat it up and give it to the baby. Because you're very conscious about the nutrients and the proteins and the fat that comes in the milk, and you want to protect and preserve that. Remember, we said you even have antibodies in this milk.
In the milk,
So if you have like milk which you stored in the freezer and you want baby to be fed on it the next day, we encourage for moms to thaw it overnight. So it's a more natural process. You leave it out overnight in a clean container and let it thaw out slowly. So this doesn't destroy the nutrients and the proteins in the milk. And then what happens is that when it's completely thawed, you just want to bring it up to room temperature. So in whichever bottle or container you're feeding the baby, you put it in lukewarm water and just let it get to room temperature. You're not heating it, you're not putting it in the microwave, you're not letting it boil. You just want it to get to room temperature. Because remember, we're trying to mimic the milk that is coming from the breast. It's not hot, it's not heated, it's just room temperature. So you're trying to mimic the same. And even with milk storage, we actually ask moms to seek guidance on how to do the storage, because also the type of fridge you have, whether it's the open door, whether it's a full freezer, there are different guidelines that have been given by the World Health Organization on how you can safely store and prepare expressed breast milk for the baby.
I know we're so constrained for time because we'll be like, so how do we do that? How do we do that?
I think we need to have another follow-up session
We will.
discuss this in
We
details.
sure will. We sure will. But of course, what we understand is labeling is important, right? And especially when it comes to freezing, so that you know
how long the milk has been in
the freezer.
Exactly.
Okay then. And then is there a way that you can tell that this milk is not fit for consumption, especially after, just storing it in the fridge or after freezing? Are there maybe like telltale signs?
So there are guidelines, just so that you also do not give milk that is not suitable for child consumption. So when it comes to thawed milk, like I said, if you thawed the milk and fed it to the baby, and we encourage it to be stored in small amounts, 30 to 60 ml to 90 ml containers, because you don't want to thaw out a large amount of milk and then this baby will only take like 60 ml, because we encourage, if it has been thawed out, then whatever baby does not consume, you dispose of it. Because remember, we're coming from a freezing process back to room temperature. You don't want now to start putting it back. And then there's also the issue of contamination. It has been removed from the fridge, you've put it in a bottle, there's someone handling it, there's a huge risk of contamination. So we usually encourage that if milk has been out for 24 hours, whatever is not consumed by the baby, that one we discard. Hence why you need to store it in smaller containers.
We do not want to waste the liquid
You
gold.
do not want to you waste the liquid gold. That's true.
All right. Okay then. And then as far as making sure that the baby is well fed, right? And then you talked about an aspect of, depending on the situation, you might actually interchange formula or breast milk. It's absolutely fine. But then again, there's some moms who'll be like, so then when is the schedule, right? Like identifying a schedule for the baby, because again, like we said, times have changed, right? This maybe mom has to go to work or maybe run her business, maybe travel and all those things. So in terms of establishing like a schedule when the baby knows it's time to breastfeed, or generally it's time to feed?
Yes.
Is there like a way that maybe you might advise, maybe a mom?
Yes, that's for newborn babies, like I said, predominantly first 2 to 4 weeks of life, the baby needs to feed as frequently as every 3 hours.
Oh wow, okay.
Or even as frequently as 2 hours.
2 hours.
Yeah, so it depends on the baby.
All right.
So in the first month of life, you expect about 8 to 12 feeds a day if you're considering a 24-hour period.
Yeah.
And there are hunger cues that you look out for. And like I said, most babies will be able to sleep for an hour or two. And then either they'll be crying, they'll be having what you call a rooting reflex, so that anything that comes close to their mouth, they want to turn and open the mouth and suckle. Yeah. So you'll be able to tell that, okay, this baby is ready for a feed. And even as you're positioning them, you'll see as soon as the nipple touches the mouth, they will open and start to suckle. So the younger they are, and there's this myth that you should not wake a sleeping baby. Yeah. So just to demystify that, especially in the newborn period, babies need to feed at least every 2 to 3 hours. So you don't expect that a newborn is going to go for 6 hours.
And they sleep a lot.
They do. And of course, mom is very happy. They're like, oh, my baby is sleeping. My baby is very calm. So as odd as this sounds, we actually encourage moms with newborns, please wake your baby up. If they sleep for more than 3 hours, because they're also very tiny, and I said they have very small stomach capacity. So if they go for prolonged periods, they're actually at risk of getting low blood sugar. So you want to feed them at least every 3 hours. And then you also want to assess in terms of how frequently they're making urine, or how frequently they're passing urine, and how frequently they're passing poop. Because the more they're taking, like I said, milk has a very high fluid content. So your baby should be passing urine at least 6 to 8 diapers in a 24-hour period. So if you're having less diapers, maybe 1 or 2 diapers, then it's problematic. Baby might not be getting enough breast milk. Yes. So those are some of the signs you can look out for.
All right. And then for the mom, in terms of making sure, because like you said, you not only just want to breastfeed the baby because doctors say you need to breastfeed the baby, but also make sure that the baby is getting nutrients, right? So for the mom, and I've seen a lot of women going to great lengths just to make sure that they have enough supply of breast milk. But then again, we almost always forget what is in that breast milk. So this is where then diet comes into play. So again, what would you say is one of the things that all moms should actually put into consideration when it comes to their diet, just to make sure that they also get enough nutrients, but also the baby gets all the required nutrients as well?
So when it comes to diet, the main thing I want to emphasize is a balanced diet for mom. Balanced diet means you're getting your carbohydrates, your proteins, your vitamins, your vegetables, your fruits. And you want to do a balanced diet at least 3 meals a day and 2 healthy snacks in between. Healthy
underline
snacks. Healthy snacks.
All right.
And the reason I say this is, I mentioned earlier, breastfeeding is it takes a lot of calorie. You burn a lot of calories as a mom just breastfeeding. And not only do you need to replace that the nutrients your baby is taking from you, you need to replace the calories that you are losing
as well.
And you need to replace them in a healthy kind of manner. Hydration as well is huge. I know we're in Africa and there are certain myths about certain foods that will increase milk letdown and all that. And there is some truth to some of these foods which actually encourage milk letdown, and there's evidence to suggest, to guide that. But in general, I would say you need to have a balanced diet. You need to keep your hydration up, whether it's by drinking water after every meal, whether it's by drinking hot chocolate, soup, porridge, whatever works for you. There's a lot. The options are many. But there's no hard and fast rule where I can say this is a breastfeeding diet and every breastfeeding mom needs to be on jahe or porridge. So if you stick to your balanced diet and you're getting enough nutrients and providing the healthy snacks in between, because if you're having 3 meals a day, that means every 8 hours you can go for 8 hours without a meal in between and be expected to adequately breastfeed your baby. When it comes to diet as well, there is what you eat also passes along to the baby. And this is why I say this, your milk is unique to your baby, and also what you're putting in your body. So there are certain foods which might be a bit irritating for the baby, if I can use that word, or a bit uncomfortable for the baby's tummy. So this is also something to note. We generally ask moms to avoid like spicy foods, because that can be a bit uncomfortable for baby's tummy, and can also make baby quite gassy. And also you have to observe what is comfortable for your tummy. If there is a food that is giving you discomfort, be it dairy, be it some form of vegetable that is making you uncomfortable, likely then the same is going to happen to the baby. So those are just the general guidelines to keep in place, but there is no hard and fast breastfeeding food
diet you need to go by. If you don't, your baby all right. So time is not on our side, and it's such a beautiful conversation to have. So maybe we'll need to have like another conversation on the same. And especially when it comes to, because like you said, there's some things that we need to put in consideration, because there's some babies who again get like allergies and all those things, so we might want to understand what are some of the maybe like allergens that mothers need to be aware of that might end up causing discomfort to the baby. And something that I've always wanted to learn about, colic, where does that come from? Because some doctors will say, listen, your baby is not supposed to have it. It's complicated. So we also want to understand that. And also weaning. You know, the baby, when do you do it? How do you do it? You know, and all those things. So I think we'll have like numerous
we need to have some follow-up sessions. There's a lot to talk about.
So I really hope that you'll make time for us.
Yes, I definitely will.
And it's so good to hear that. All right, Dr. Jane, thank you. Thank you so much for your time today. Dr. Jane Mate, consultant pediatrician right here at Mpesha Hospital. Such an amazing conversation that we had today. I've learned a lot. I don't want to lie.
That's good
and I hope that, you've learned a lot and also enjoyed the conversation. But remember, like we said, any other question that you have, feel free to use our WhatsApp number down on your screen. Ask your question away. And of course, Dr. Jane will answer them. But for now, goodbye, God bless. And remember to stay safe. Goodbye.